In our group project, we designed a commercialization strategy on Hyperfoods, which is an AI-driven nutritional analytics platform that identifies bioactive food molecules with disease preventive potential. As the inventor, my role was to lead the scientific and technical vision, building the AI omics integration model, curating biomolecular datasets, validating algorithms, and protecting intellectual property. Throughout the commercialization process, I interacted closely with other stakeholders as well: the Wellcome Trust as an ethical and translational funder, First Star Venture Capital for scaling and investment, Unilever as the corporate licensee, and MEHRA for regulatory alignment, and NHS NICE for clinical integration. Our collective goal was to transit the hyperfoods from TRL 3 to 4, which is proof of concept stage, to TRL 4 to 5, which is validation and translation stage. Initially, I felt excited about translating my scientific research into a real-world impact. It was deeply motivating to see how molecular data and AI could transform nutrition and public health. However, I also felt frustrated and tensed at the same time, especially balancing scientific transparency with IP protection and navigating differing stakeholder priorities. For example, while I focused on ethical access and data integrity, the venture capitalist emphasized profitability and the corporate partner prioritized market scalability. Emotionally, I often felt like a bridge trying to connect science, ethics, and business, which was rewarding but also challenging at the same time. The multi-stakeholder collaborating ensured a balanced approach: scientific validation from academia, ethical oversight from Wellcome, financial support from BC, and market reach via Unilever. We successfully mapped out a clear TRL progression defining IP ownership and embedded equitable access through NHS partnerships. However, some areas were less effective. The corporate licensing model risked diluting scientific credibility and slowing innovation through complex sub-licensing chains. Additionally, our regulatory pathway was somewhat ambiguous, as AI-based nutritional tools currently sit in a gray zone between food tech and medical devices, creating uncertainty for approval and adoption. These outcomes stemmed from the inherent power dynamics between scientific, commercial, and regulatory stakeholders. As the inventor, my priority was evidence-based integrity, ensuring that AI predictions were validated biologically, yet venture capital demanded rapid scalability, often conflicting with the slower pace of scientific validation. This reflects the broader value of death in research translation, where promising discoveries fail due to misalignment between academia and industry. Moreover, Unilever's business model focuses on consumer product delivery rather than sub-licensing it, which raised a valid challenge from my perspective: that why wouldn't Unilever commercialize or deliver its products rather than just sub-licensing it? And this highlighted a gap in our strategic reasoning and forced me to rethink partnership structures. Ethically, I also analyzed the AI data governance challenge, ensuring our data set, which contains 7,000 plus biomolecules, 20,000 proteins, and 10 million network interactions, and transparency and bias mitigation standards. The collaboration with Wellcome Trust was particularly valuable because it aligned commercial growth with responsible innovation, ensuring IP protection didn't compromise accessibility. As an inventor, I realized I must communicate in both science and business language, translating molecular biology into economic and social value. I also learned the importance of defining a clear route to market early, addressing both regulatory readiness and ethical impact. This project deepened my appreciation of interdisciplinary teamwork and how conflicting priorities can be harmonized around shared goals of public benefit and sustainability. If I were to improve any steps within our commercialization strategy, I would propose Hyperfoods as a spin-out company rather than just licensing it broadly, maintaining scientific control while engaging corporates as co-developers rather than sole licensees. I would initiate early dialogue with MEHRA and NICE to clarify AI as medical device status and preempt regulatory barriers. I would also establish a data ethics board to oversee AI transparency and societal impact. Finally, I would strengthen communication among stakeholders, ensuring all decisions remain mission aligned, transforming food into medicine while keeping access equitable. Reflecting as an inventor, this process taught me how scientific discoveries evolve into innovations with real human impact, but only when ethical, commercial, and regulatory dimensions move in harmony. Hyperfoods represent not just technology but a step forward, precision, preventive, and equitable nutrition for all.